esteemed guests, partners, and friends, I'm really pleased to welcome you on this very special occasion of our Celebrating Womanhood Art Gala themed Elevating Women's Voices for Quality Maternal Health Care. This evening we're here to celebrate the beauty and strength of women and to honor their essential role in society.
If the man with a womb is not heard, if the woman is not listened to, especially where maternal health is concerned, then we have a problem. And that is why in Celebrating Womanhood, health has definitely met art to showcase various ways women are speaking and various ways women want their voices heard. And of course, various ways that we all, each and every one of us, can elevate our voices for quality maternal care.
MSD for Mothers, as some of you know, is an initiative of MSD, the pharmaceutical company, and it's an initiative focused on maternal health. We want to help to create a world where no woman has to die giving life. We feel that it's every woman's right, every Nigerian woman's right, regardless of her educational status, her earning, how much money she has in the bank. Every woman deserves quality maternal care. And so, this initiative was started with that in mind. When I thought about today's theme, there's a certain phrase in Nigerian lingo that came to my mind. Actually, two. There was sorosoke, which is the message to the women. You have to speak up. And then there was loud it. In Nigerian lingo, when we say loud it, it means elevate it, make it louder. And it's really because if we are to have any meaningful understanding of a woman's clinical experience, and if that is supposed to shape how we offer a woman care, if we are supposed to encourage and sustain women going into facilities to receive care, we need to understand how they receive the care, how they perceive the care that they receive. And that's why it's very important that we listen to women. I'm excited to celebrate with the entire Nigeria Health Watch team and all our stakeholders here present. Stakeholders from government, from the development sector, from healthcare workers to community stakeholders, the art community. Thank you so much. Many of you are already doing a great job listening to women, but I feel that we can do more. And you can extend this and make it a norm and get other people to start listening actively to the voice of women. And so I celebrate the diversity and the indomitable spirit of women all over Nigeria, represented by every single woman in this room, and also depicted through the art forms that some of you have already seen and will be experiencing today. I want to say thank you to policymakers, to healthcare workers, to development partners, our implementing organizations who are here present, stakeholders, community stakeholders, husbands, fathers, mothers, sisters, daughters, friends, who are interacting with these women and have the opportunity to listen and are sharing what these women are saying. Your voices are powerful. Your actions make a difference. We need to work together to institute systems that seek perspectives from women. When women speak, we must listen, we must share, we must reflect, and collectively we must act to ensure that no more Nigerian women have to die giving life. Thank you very much.
The Celebrating Womanhood Art Gala is a concept of Nigeria Health Watch. We call it our Health Meets Art initiative. And this was conceptualized in 2021 with a goal to pull together stakeholders beyond the health sector to be advocates of quality maternal health care. Art has the ability to attract attention, evoke emotion, sustain interest, and stimulate memorable responses. And this is why we have decided to fuse arts into health, communication, and advocacy as a creative way to build knowledge and also to create awareness on maternal health issues. Typically, when we discuss maternal health issues, it's usually in a symposium, in a conference, in a room of many people from mainly the health sector. But you and I know that maternal health issues do not affect only people in the health sector. And this is one reason why Celebrating Womanhood Art Gala seeks to reach audience within and outside the health sector to have a larger pool of advocates for quality maternal health care. Now, the theme for this year's Art Gala is elevating women's voices for quality maternal health care. Vivian Iyadini, they've set the stage and said a lot about elevating women's voices, but I believe that we can't say it enough. We'll just keep reiterating till the voices are loud enough, till the voices are listened to enough to begin to bring the change that we are advocating for. If any progress is to be made towards achieving or contributing to the Sustainable Development Goal target of having less than 70 maternal deaths per 100,000 live births, then we must prioritize listening to women's voices to understand her unique needs, perspectives, experience, and challenges during and after pregnancy. The theme of this event actually recognizes the fact that women's experiences, women's voices, women's needs are a very great pointer to building very strong systems, designing systems that work for maternal health care.
Maternal death, which is the death of the woman while pregnant, during labor, or after delivery, is a pressing issue in many communities worldwide. And one of the most effective ways to address this global health issue is implementing MPDSR, maternal and perinatal death surveillance and response. So this art portrays how options through evidence for action, E4A program, uses community MPDSR, especially the social autopsy approach, to reduce maternal deaths in Soba community that has the highest maternal mortality ratio in Kaduna State, Nigeria. Here, community members grieving and preparing another maternal death for burial because maternal death is very high in this community. And the most common causes of maternal death in this community are home delivery and delivery by the traditional birth attendants, usually influenced by the decision makers in the family, the husband and mothers-in-law. The women are not allowed to make decisions on their own, even if it's related to their own ex. And here we have the social autopsy section, which is the key intervention of the community MPDSR model. The social autopsy allows the community, especially the religious leaders, the traditional leaders, and women leaders, as well as the healthcare workers, to come together in the community to discuss the root causes of maternal death, in line with the 3 delays that we just seen, that are the major causes maternal death. And they also lay emphasis on the bias, gender norms, and socio-cultural factors that are affecting women to make decisions in the community. The meeting also provides opportunity for the women to voice their concern about how their inability to make decisions is negatively affect their health, and also to make some suggestions. Following the implementation of the actions that are generated through social autopsy, we have observed a series of changes, a positive one, in Soba community, which has reduced the maternal death. Here, we could see that men are now becoming the agent of change, following their pregnant women to the facility for ANC visits, facility delivery, and postnatal care. And also, through the intervention that generated from the social autopsy, a traditional birth attendance clinic that was responsible for most maternal death in the community was shut down. So, what do women want? What do they want? They want the stakeholders and the government policymakers to replicate the community MPDSR model in other Nigerian states so that we can achieve skilled birth attendance, essential life-saving commodities and equipment, water, sanitation, and hygiene, as well as regular power supply at all levels of care. They also want community mobilization and sensitization, whereby the women will be empowered to voice their concern and also make informed decisions about their own health, so that that will increase the utilization of improved healthcare services, and women and babies will be alive. Thank you.
In the course of our work, we deploy the human-centered design to we collaboratively work with girls, adolescent girls aged 15 to 19 years, to generate innovative solutions that addresses issues around girls' human capital. And it's focused on their adolescent sexual reproductive health, economic empowerment, maternal and newborn child health, and life skills. And how we do that is through the community and integrated health approach, where we go to communities to sensitize people on need for adolescent girls to see the relevance and also access healthcare service as it relates to their sexual reproductive health. So as you can see, our artwork here, it's themed Girl with a Plan. And a girl with a plan is a phrase that usually connotes a girl that is self-motivated. She's optimistic, she's resilient, she's beautiful, she's strong, she's proud. Can we clap for such a girl, please? As some of us are seated here. So a girl with a plan is a girl that has charted roadmaps to achieving success in life. So she has goals, she has objectives, and then she tries to meet them to achieve those goals. And how does she do that? She taps into her social support network, who could be a health provider, as you can see here. It could be a mentor, it could be her husband, it could be her mom, or even her peer. So we at Adolescent 360 Amplify, we recognize that to have a good plan, it's very essential in achieving success in everything we do in life. If you do not have a plan, or like the saying goes, if you fail to plan, then you plan to fail. And how we do so, like I said earlier, is through community systems. So we go sensitizing people. We strengthen the demand and supply part of adolescent sexual reproductive health. What I mean is we have people that mobilize and sensitize the community leaders, the religious leaders. We pay advocacy to them. And also strengthening the supply side is through the healthcare workers, the service providers, ensuring that they are youth-friendly when they are talking to our adolescent girls, because we know that adolescent girls aged 15 to 19 are vulnerable, and they require some form of, the way you address an adolescent girl is not the way you address, an adult. And in the course of our work from 2020 till date, we've been able to reach more than 250,000 adolescent girls, and of that number, about 243,000 of them have adopted modern methods of contraceptive. And not only that, we have over 150,000 adolescent girls that have been empowered to speak up, just as the previous presenter said, amplify their voices, make sure their agency is built. And we also work in Kaduna State and some other states, Kaduna, Nasarawa, Ogun, and we also provide technical assistance to states such as Ogun, Lagos, and Oyo, where we have exited. So we do the maternal and newborn child health adaptation, where we have 4 thematic areas that we discuss. So these adolescent girls, do they plan for their pregnancies? Is there a demand for services that requires maternal and newborn child health? And do they, after giving birth, what follow-up mechanisms are in place to ensure that these people adopt modern method of contraceptive and do not have complications, what we say postpartum complications? So we do the postpartum family planning. So at this juncture, I would say, this is a girl with a plan, discussing with her service provider on her goals, her plans, and how she tries to achieve those goals and plans by adopting a modern method of contraceptive. So we at Society for Family Health are honored to work with Nigerian Health Watch to celebrate womanhood through this unique form of an art piece called Girl with a Plan. Thank you.
In the painting, we see a woman and a girl who appear to be one person at different stages in their life. In the young girl's head, we see, "Dear future me, your body is yours alone. Make decisions for its benefit without guilt or shame." And for the older version of herself, we hear her say, "Dear past me, your body is like a canvas, so own it, paint it with your own brush strokes, speak for it, let your voice be heard." Bodily autonomy, or being able to make decisions for oneself, is a lot like finding yourself. And when you never realize or exercise that right, it's like discovering a part of yourself that was once missing. And being able to make informed decisions about what you do with your body is really at the core of that discovery. Of course, what the woman and the young girl are saying to themselves is easier said than done. We know that if she's limited in her access to healthcare, to education, or to information about her reproductive health, it's not only unlikely she'll be able to make decisions regarding her body, but even more unlikely that she'll be able to make any decisions that are beneficial to her body and her overall well-being. We can also imagine a scenario where even if she does have access to those services and can indeed exercise her bodily autonomy, it would be incredibly difficult for her to do so without bearing the weight of guilt and shame if she's vilified in exercising this right by those around her. We can assume, especially in Nigeria, both versions of this girl is urged and pushed to aspire for marriage, for example. Yet 56% of married Nigerian women claim decisions regarding their own health care are made by their husbands, and only 11% are able to make such decisions for themselves. The title of this painting, "Your Body, Your Choice," does not only echo UNFPA's core mandate to generate communities that recognize women and girls' right to self-autonomy, but that these communities can't be formed unless men and boys are involved in the conversations. I just want to highlight the Promote My Sister campaign that we launched last year and recognize that there are a lot of women today that have spoken and have expressed their solidarity to stand by one another, and that's what it still requires, but at the same time, in order to move forward, we would also enjoy and continue to appreciate when men and boys are also a part of the conversation. Thank you.
I just want to take us through a voice that was once suppressed, but was transformed to be a voice for the people. And this is the suppressed young woman that didn't have a voice at all to speak. But through the Challenge Initiative program, she was able to get a voice and to be a change agent in her community. And is now speaking to the power that be, speaking to the decision makers. How did she get this? How did she transform from being suppressed to being a community change leader? What happened was that the Challenge Initiative partnered with her state governments, and through the partnership with state government, the Ministry of Health, and the primary health care department, she was able to participate through some capacity that was built and coaching that was given to her on advocacy still and on social mobilization. So based on these skills, she's able to engage with decision makers. You can see her speaking to decision makers at the state and national level to canvass for services that will help her access family planning services within her community, and not only her own community, but also provide family planning services, as we can see, to other less privileged women that cannot be able to speak for themselves and might not be able to have access to these services. So this woman, with time, was able to mobilize women with other women in the community that formed a chunk of the social mobilizers in that community to mobilize women across 21 states in Nigeria that now have access to family planning services. And not only that, she's able to engage with decision makers and be able to get fundings for family planning, consumables, and commodities in the community, and also some fundings to help mobilize women to access services in the community. So this is the voice of once upon a voiceless woman that has now become a change agent and is now a voice for other women advocating for accessible family planning services in her community. Thank you so much.
It's a pleasure to be here, and I congratulate Nigeria Health Watch and the partners MSD for hosting their second celebration of women using the arts. We have a lot of maternal health issues across Nigeria and as indeed other low-middle income countries. I have been witness to quite a lot of them in my state, Kebbi, but through interventions by various partners, the state government, and even civil society, we're not doing so badly. We've been able to improve some of our indices. I particularly liked the last presentation about using the community ward committees, we call them, community development committees, to influence decision and social behavior. And that's exactly what we do and what is making a difference. There are various partners like USAID that are carrying out these programs. So we thank them. We can't do it alone, and we hope that they will continue to put hands together with government at all levels to bring change for women. Another thing I would like to talk about, particularly as we're talking about maternal health, is the unique opportunity that the maternal health clinics across our nation offer for our women to improve women's cancer outcomes. The maternal health clinics, particularly the family health clinics, are an opportunity for a lot of us to get cervical cancer screening, whereby this hasn't been well established in our health system, and it's not something that most women even know about. The outcomes that we're seeing in cancer, be it breast, be it cervical, are really enormous, and if we can piggy bank the cervical cancer screening and early treatment services in the maternal clinics, there would be a lot of impact on our cancer figures.
Dr. Okoli, could you please tell us how you incorporated women's voices into the design and implementation of the Right Come 3 project?
So we selected a group of 24 women from both Lagos and FCT and gave them cameras, trained them to actually document their journey, you know, throughout the day and the period that we were actually asking for this information. And I would just hint on a few stories. We had people, a banker, we had traders, we had business women. And, you know, the banker, for instance, documented her journey through the traffic, you know, lateness coming back from home, and sometimes missing out taking her drugs. She was hypertensive. And then the trader herself, you know, talked about how she believed in God, so spirituality came into it. And when she didn't have money for her drugs, she would pray about it, hoping that prayers can actually pray out that illness. They talked a lot about nutrition. I remember one of the women who actually had a fridge in her house, but that fridge turned into a cupboard, used to store other things because she just didn't have money for foodstuff in her house. But above all, you could see women actually having very low priority for themselves, thinking about the next thing for their children or their husband and not necessarily for themselves, even though they need drugs for high blood pressure or need drugs for diabetes mellitus. And so all these needs actually helped us develop a women-centered quality of care model where we knew that education was very important. Health literacy was an issue, and we needed to do a lot around prevention in the health facilities. But we also needed another format where they can actually be supported for self-care. And that's why we used the digital health technology, which was also run by our partner MDoc, where women actually gathered self-care as well to modify their lifestyle. And finally, I would like to say that it didn't just stop at the baseline or start of the project. During the project, after about 18 months, we also went back to the women, selected a group of them in both states, and assessed their experience of care. Were they getting those care that the healthcare workers were telling us that they were supposed to get, and what was missing? And one of the key things that came out from there was that actually they did get all those tests, but the healthcare workers were not actually telling them their results. You know how you move through the clinics and the healthcare workers might think it's not even important to tell you your health results. But once we had that, we fed that back to the QI teams, the quality improvement teams, and that actually changed. And then we also had care linkage meetings between the platform where the women received self-care support and then the health facilities. And that helped a lot because the women might not have time or even the courage to complain in the health facilities. But when they go to their coaches on the platform, they are able to tell their stories, and the coaches are able to bring that back to the health facility to say, how can we ensure that we assess the journey of this woman to actually ensure that we improve that care. Thank you.
Really interesting. Yes, please.
Chen, I will hand over to you.
Please share your thoughts. You looked really eager to contribute. So yes.
Thanks, Dr. Coley. Smiles for Mother aimed to reduce maternal deaths, but with a focus on postpartum hemorrhage. That means excessive bleeding after childbirth, which is the leading cause of maternal mortality in Nigeria. And the way we sought to address that was to adopt what we call a human-centered design approach. What that means is look at it from the lens of the end user. So from the end of the health worker offering the care, and also from the end of the mother receiving the care. And then trying to make sure the solutions are ones that address the problems the way they see it. So coming from that perspective, we found a few things. I think one was on the supply side now, there was a lot of issues with the quality of the medications that are being provided. So we leveraged a new WHO recommendation at the time that provided options for more drugs to be used to prevent excessive bleeding after childbirth, and supported the states, Kano, Lagos, and Niger, but also working with the Federal Ministry of Health to introduce this new drug called heat-stable carbetocin, which we thought was better suited for Nigeria, where drugs like oxytocin that are used, the quality is typically compromised if you don't have cold chain, just as we lost power here, right?
So again, I'm so sorry for apologizing, but please say what oxytocin is.
What?
Oxytocin,
okay.
heat-stable carbetocin.
Oxytocin is an injection that you give to women after they deliver to prevent bleeding.
Excessive bleeding.
Yes, excessive bleeding. Yeah, exactly. So we introduced a new agent that also does the same job, but doesn't need to be stored in a fridge, especially in a context where power is not assured.
Right.
But to also make sure that we got the effects or the impact out of that, we needed to think from the lens of the mother, right? And we find out majority of women actually in Nigeria are not delivering in the health facility. We still have a larger proportion that are delivering at home or in a care center that never interact with the healthcare worker. So it became very essential to think about from the lens of Greek women, what will make you have a more healthy journey for your pregnancy. And that's where I was nodding, because that relates very much to what Dr. Coley has been talking about. So we worked with the communities to develop patient literacy materials, which means documents that women can read and they become just more informed about the risks they face and so on, which makes a big difference. And in doing this, is really working with the women to say what kind of message will resonate to you. Right. What kind of pictures will tell the story, right? In many instances, we found just interacting with the women, from our perspective, the way we would draw a kitchen and food stuff and the way we would draw a health facility didn't mean the same thing to the women. They will see the pictures and completely get a different message. So just working with them and using their voices to design something that actually works for them was a way that we incorporated women's voices into Smiles for Mothers program.
Okay, well, for me, I think the first question we had to ask ourselves is, where do women access family planning services? Where do majority of women access care? And we answered that question through research. We found that majority of women access care through the private sector. And not just only the private sector, the community private sector, the community pharmacies, and the patent and proprietary medicine vendors, or what majority of people call the PPMDs. And that was actually what informed our designing the project around these private sector providers. And we didn't just train them, we trained them on an expanded scope of family planning services. So you're not only just going to buy, you're also going to get services provided to women. So we are expanding access to options available to women to access family planning service. So women were considered in the design of the project. And we did not just do that, we continued putting the voices of women front and center, both for the implementation of the project. And we have a forum where we call that we call the community dialogue, where we sit with women and find out what they think about the services that they are receiving from this category of provider. And it will interest you to know that, quite unlike what we thought, initially, that when you have facilities around women, chances are that they will patronize or access those facilities. But it's not true for family planning. And this is what we got through the voices of women, that they prefer to go to facilities that are a bit further away from where they live, because they don't want to be seen in most cases. So again, those were the very voices we heard from the community that we reprogrammed. So when we are now talking to women, we're not just telling them, go to facility A or B. We are saying these are other options available to you. So you can actually go beyond where you stay to access services. And then we also moved ahead to implement what Federal Ministry of Health has rolled out, called the DMPA-SC, as self-injection, which is actually a 3 months, I'm coming to that, which is a 3-monthly injectable for women. That also creates that autonomy and agency for them to be able to inject themselves after being trained at the first dose. So again, that's also removing that barrier that makes them always go back to the healthcare provider. So that is also coming from the voices that we've heard from the community and from women. Thank you.
Thank you so much. And could you please explain what patent proprietary medicine vendors are?
Okay, they are the conventional chemists.
Yeah.
I think that's the most popular.
Everybody knows who chemists are.
So everybody knows chemists.
Yes, yes.
So those are the things that we considered.
So Jennifer will be speaking to us about the self-care project and how White Ribbon Alliance Nigeria incorporated women's voices into the design and implementation of that project.
One of the key areas of White Ribbon Alliance is advocacy. Our advocacy also includes citizens' engagement. But that's not the best part. The best part of our project implementation is the fact that we serve at the community level. We literally step into the place where the beneficiaries or the citizens take advantage of self-care. I just heard her define self-care as being an individual's opportunity or choice to be able to take care of your health or the health of your family with or without the presence of a health worker. So what did we do? I mean, I remember one time when we were in the community, and while we saw quite a lot of women, they were talking, they were coming out of an antenatal care. I saw one rather young lady, you know, sitting down, and she was literally holding her baby. And I was like, okay, I'm tired, let me just sit near her. And I asked her, how are you doing? What are you doing here? At first she was ignoring me. I'm like, are you okay? Can I help you hold the baby? She just turned to me, she's tired. I mean, she just went through the stress of giving birth. And her mother-in-law just told her, the next time you're coming, it should be twins. Now, this is funny, but for her, she couldn't imagine what it would mean having gone through this pain and going through it again. This is what self-care is, giving the woman the ability and the power of choice. This is giving her voice, the ability to take care of her health and her reproductive health, where, when, and how she wants to do it. I mean, I heard you talk about the MPA Etsy. Imagine a young lady who does not have the access to maybe go a mile or two to access a healthcare provider for her contraceptive, but within the comfort of her own locality. Now, she doesn't have to explain to the healthcare provider that I want to hold up being pregnant for a while. She takes it, she takes a self-injectable, of course, haven't been trained, of course, and injects herself, and is able to control her family size within the next 3 months or so. That is what is self-care.
Okay, so very quickly, in 2 minutes, please just tell me how important this has been, and just reflect on some of the successes you've had. Please feel free to share some real-life examples, personal examples, some women that you've seen your projects impact, and just reflect on how important you think it is, really, to incorporate women's voices into projects like you have. And I would like to start with men.
Okay, well,
yes.
I think for us on the Integrate E project, one of the key lessons that we've learned, having to talk to women all the time, like I said, we didn't just start at the design stage. We also kept listening to women as we implemented, using different forums like the community dialogue, where women sat together and we listened to them, their needs, how they want services to be and all that. One interesting thing is, as a programmer, you will tend to think that if you bring services closer to them, they will rush those services. But interestingly, we saw something different. You know, by the time, you know, we kept talking with them, kept listening with them, we had to pause and reflect and say, oh, is this possible? And immediately we started giving them those choices, not the one that is just behind their house. We saw that the patronage went up, the uptake of family planning services went up in the communities where we work. So it's a very important thing that at the point of designing a project, it's good to get women's voices. But don't stop at that. Continue to hear their voices even as you implement, even up till the end of the project.
You know, people will normally say, oh, women, they are not digitally literate, they can't use their phones, they can't, you know, whatever. But I can share that during the COVID period in 2020, we had sessions through eco sessions. You know, you have to use your phone to log on with the healthcare workers. But during
what are eco sessions?
Okay, during virtual sessions, online sessions where we taught healthcare workers. But during that COVID period, women could not go to the health facilities because we had, if you remember, we had that period of lockdown. So we decided, okay, why don't we start the same sessions for women? You know, them logging on through their phones or their husband's phone or their sister's phone. And we thought it wouldn't catch up. But lo and behold, we did that on Saturdays. We worked with our partner, MDoc, and we had plenty of women actually logging on to hear what, you know, was being done. We used different topics, and later on during the program, the women started shaping the topics, telling us what they actually want to hear. You know, do they want to learn about breastfeeding? Do they want to learn about hypertension in pregnancy, and breaking it down to their level? And I'll finally say that I'm so happy from the contributions we have here. There are a lot of policy makers in the audience, and I just want to say, if you're a policy maker and you're trying to shape your policy without involving women's voices, that policy is going nowhere. I know sometimes we are very comfortable in our own room, room and we are not intentional. We have to be intentional, including healthcare workers. Otherwise, there is no quality of care that we are providing to the women.
The biggest lesson I learned was sometimes as programmers, we also, when we put the word quality out there, we think very technically about what quality means. It's about the quality of medications. It's about following the protocol to the letter. Quality to the women, we found out, means respect, respectful care, right? On Smiles for Mothers, from the get-go, if you looked at the training manuals we're using to interact with our health workers, there was nothing about respectful care. It's about the dose of the drug you need to give and when you need to give it. So sometimes we expect them to do something that we're actually not emphasizing or training them. So incorporating women's voices is making sure at every point we talk about quality of care. We're talking about respectful care. What does that mean all through the journey? What does it mean to inform your client in a respectable way? And these are things I can say that we have very huge challenges with and need to continue to look at so that we actually deliver what the women want. Thank you.
You know, in the quality of care strategy, it builds on 3 premises. 1, safety, effectiveness, and human-centered design. The reason for these 3 pinnacles is because we don't just want the woman to be respected, but to respect to come from the person who knows, from a standpoint of knowledge. The reason why a woman walks into a facility, I mean, you know, we do have, when we speak to them and they can put up their voices in papers, you find out that most of the women who wrote out their own major concern was that they wanted to be respected. I do not want to be insulted. I want to be treated with dignity. And while we can capitalize on the woman having access to this, but the provider of this care needs to be sensitized. And I'm very excited because we have policymakers in the house. This is where we need to push in as much effort as we can to make sure there's enough training sessions. I'm not talking about a celebrity or a ceremonial training session that you do for 1 or 2 hours. Take time to sit down with healthcare providers, whether men, whether women, and tell them, in fact, relate this to their mothers, relate this to their sisters. Let them understand that if you are going to treat the next woman who works in here as though your sister was pregnant and needed help, how would you treat her? So human-centered design in the quality of care means that we need to take our time to train the community health care providers, because unfortunately, that woman is only acting out of a point of knowledge. She does not know any better. If she knew better, she would treat that woman with respect.
How often do we actually pause to say, are we really meeting the needs of these women, or are we just sitting in our offices and assuming that this is what they need, and then forcing women to conform to what we've already designed? Thank you so much. Please help me thank my awesome speakers for sharing their thoughts as they go back to their seats. Thank you.
Thank you. Good evening, everyone. My name is Mario Lodo. And tonight, well, I'll be exploring the woman. So I've always believed that women are fascinating. And one thing that gets me the most is how their bodies take up the pain and then close like it's nothing. They say the pain of birthing a child feels like a broken bone. I cannot even begin to imagine how hellish this must be. I broke my bone once. And I remember yanking curses across the room as my mother worked on putting the bones back together. You tell me this is what a woman has to go through to birth a child? I'm sorry. To every woman here who had to go through hell just to break into the world something so heavenly, I'm sorry. These days, I imagine my mother going through the pain of a broken bone 7 different times. This woman who turned a smile into a rainbow, learned to conjure them on nights when eyes are too cloudy to hold back the tears. My mother would always say, a woman must know how to handle pain. If you cannot survive the breaking of your heart, how do you intend to outlive your labor? And maybe this is why she finds it so easy to forgive this man, her husband. Her body is a museum of scars, but still she finds a door for him. Her back is a flashback of drunk nights and swollen face. When you find yourself loving a man who empties his anger in you, Your heart becomes heavier. The burden begins to weigh you down. And every morning, when the feast unfolds into a tender palm, scoops an apology and smears it on your swollen face, you greet each tenderness with an excuse. He's actually a tender man. He's just going through some tough times. Aren't we all broken? Aren't we all flawed? Yes, Mama, but don't we all deserve a love that knows the difference between a wall and a face? Don't you see? And so this night, this one, this is for the single moms, for the breaking heart and all the bruised ones. This is for the little moms, children birthing children for all the days to come. This is for Oga's wife, for the career women and the Chop Life gang. This is for married, the single, and for breaking bodies. For women who think they are too much and for those not enough. This is for Asanwa, Asankpete. For chocolate mothers who could never be robbed of their sweetness. For roller coaster women whose voices could never be tamed. This is for Eleni Juege. With a sparkle in your eyes, softly, you've got my night capture. This is for Nyarinya, a walking melody. You make the piano stout the keys. This is for every one of you. Women who defile the odds. Even when the world have their hands to your throat, you never forget to dress to kill. This poem is for you. Women will learn to find yourselves way before the search party ever called you beautiful. Because you are beautiful.
This is an image that depicts different stages of a woman, from an elderly woman who has gone through life at various stages, and to a mother who is lifting her baby to reflect the theme of the gala for this year, elevating women's voices through maternity health care. Yeah, so there's a happy woman who is able to raise a child, who is able to go through maternity successfully. It's an advocacy for safe maternity.
Women's voices are important, and we use every platform to promote that. I believe that women are powerful. We just need to remind them that they are powerful. As mothers, we are very powerful. We shape the future of the world. We raise the men and we raise the women. So we must remind mothers that they are so powerful that they can change the world. As daughters, we care. We watch out for our parents, we watch out for the siblings, we watch out for our communities. So it's important that at every point in time, we remind our daughters how beautiful and how important and how powerful they are and can be. As sisters, I just want to use the scripture in the Bible when, I think it was Lazarus' sister that told Jesus Christ, I said, if you had been here earlier on, my brother would not have died. That is a woman, that is a sister. And so what do we do when we have the opportunity and a platform like what we have as women who work, women who have been opportuned to be policymakers and who have a platform to change things? What we must do and what we do every day is to create opportunity for other women to speak up. We encourage them to stand up. We encourage them to take their rightful position. We encourage them to develop themselves. We encourage them to recognize who they are. And in the Federal Ministry of Health, as part of my work, I'm surrounded by young women that I mentor, and I surround them also with young men that they can mentor so they know that they can be powerful enough to be confident in the presence of men, whether as bosses or as younger officers, so that together we can change the world. So women, rise up. Use your platform well. As a mother, your platform is endless. It's the world. As a wife, your platform is endless. It is the power that women have over men. Women are the neck. As wives, we are the neck that turn the head of the men. Wherever we turn the head, that's where it goes. You must learn to use your skill. As sisters, we stand in the gap all the time. So a woman is a complete package. You are a daughter, you are a wife, you are a sister. And even if you choose not to marry, you are still the king's daughter, all glorious within. And every opportunity you have, you use it to make a difference.
I believe in the future where women will have more days for annual leave because they need time to rest during or after their menstrual cycle every month. I believe in a world where women would earn more than men because women deal with more issues than men. I believe in a world where a married woman will earn more because of her children, and she will earn more than a married man because the face of poverty is the face of a woman and children. So a woman will earn more. This is what we believe in. In Plan, we demonstrate it, we act it, we live it. It is our lifestyle. It is not just a good thing to do. It is the right thing to do. And that is the message for us today. Thank you.
I really hope that the power of all the art that we are seeing here tonight and the stories that we have heard will be sold, first of all. Most of the artists are women, so that's economic empowerment right there for us. But I also hope that it will be a constant reminder of how many women die every single day. While we have sat here listened to story, women in Nigeria have died while giving birth. There would have been at least one woman dying in each of the geopolitical zones while we have been here for preventable reasons. So I hope that we will bear that in mind and really use our voice. And women, you are so right, we have to stand up for women. It is our sisters dying. It's our best friend. It's our confidant. It's our mother. One day it could be our daughter. Do we really want that? Contraceptive prevalence rate in Nigeria has not moved for a decade. Maternal mortality has increased. And gender-based violence is going through the roofs. It is time, women, that we stand up and use the momentum of this evening with the stories all these art pieces tell to change the story about Nigeria's maternal health care. This is about lives. It's about the child's right to a mother and the mother's right to see her child grow up. I'm coming to the end of my term in Nigeria. And to be part of the gala here tonight leaves me with hope. You're strong Nigerian women. You can make the change we need to see.